Hey, get the shot of Arnold downloaded. Post that up. Come on, Johnny. Come on, kid. I like that.
Trying here. This one, dude, I'm having a problem activating this bicep.
Want to get Billy out of here. This guy.
Fucking.
Jeez Louise.
Oh. Yeah, did a good little bicep tricep workout. Took Echo to the gym second day today.
How did Echo do? Good?
She did great. Yeah, she does great.
Yeah, I don't think Striker, my girl, man, you take her, she's like Huskies, and that's Psycho. You got an intelligent.
Oh, you got the Malinois.
Yeah, he's got the Malinois, who is trained. Yeah. Not just.
Yeah. Seriously trained.
I mean, we snuck into your house and all that, but I won't say nothing.
She wasn't there though.
No, she wasn't. Good point.
See, Sasha already knows you guys. She knows the scent. This one doesn't. I think she'd be a little bit more. She's more of like, what's going on here? She's not like domesticated. She's like, even when she's walking, she's like, all right, let me see what's going on. But at the gym, man, obviously she'll just lay there. Just chill. I don't know how many people come up to me like, oh my God, like, is this dog going to do anything? You're like, no. And they can barely even see it. So like that dog is seriously trained. I'm like, yeah. And
I can see how much. I could see non-dog people asking. If you're a dog person, you already see that the dog is well trained to where it's not.
Yeah. So, but that's my biggest thing. I don't want to make anybody else uncomfortable with the dog, obviously. So I try to respect boundaries, areas. So, somebody can go in and do their training. They're not having to worry about her asking me like, hey, can I get over here and get on this piece of equipment? Like I usually put her out of the way. And having Sasha for so long and doing it with her, you kind of learn like, all right, you got to scope the room, find out where's the best place to put her or where's the best place to sit. So you're kind of away from everybody. Nobody's in back of you. I mean, that's probably the best thing.
Smart call.
Yeah.
Smart call.
Yeah.
Hey, let's jump into protocol of the weeks, or what is Titan Medical doing this week?
So Masamorelin, we kind of touched on it last week. So this is another peptide that is a growth hormone releasing hormone peptide. So, and it's oral. So this one's a capsule. And this one will not stimulate hunger. So you get all the benefits of raising growth hormone levels, but you get no spike in like a big G-Relin boost. Like, so if you wanted MK, you want all the benefits of MK, but you couldn't control your hunger or couldn't be disciplined enough to eat, right? This is going to be your go-to option. So this is going to be a really good one. So this one was FDA approved in 2017. The company, I don't know if they didn't have the funding or what, so they're looking for a strategic partner to go back to market with. So at that point, it's an orphan drug. It's there for us. So, we started looking at these things. We're like, what could we, possibly, add to the mix that's going to be a benefit for somebody out there that, one, didn't want injections, because you have a lot of growth hormone releasing hormone peptide injectables like CJC, ipamorelin, tesamorelin, hexarelin, but oral-wise, it was only MK. And like I said, for the people that were able to utilize that the right way, it's a game changer. But for people that are not disciplined and not able to utilize that tool correctly, it can work in a negative effect to you, right? And we don't want that. The whole point is to get you a positive, good result. So that's where this really comes into play. The FDA approval is for adult growth hormone deficiency disorder too as well. So it's right there. So at that point, Masamorelin, this one's been a game changer for us. You get $25 with using the code Tighten Up. You can call or text that today, 727-389-3220. There's no blood work that's necessary for this therapy. Would I get it anyway? Absolutely. 100%.
So is blood work needed for MK?
No.
Okay. So is blood work's more for the
hormones?
Yeah.
Yep.
The hormones. Okay.
Testosterone, estrogen, progesterone. If you're getting IGF-1, straight IGF-1, blood work's needed, necessary for that. So, this is some of the different things. So if you don't want to, do blood work per se, right off the bat, you can see the provider, order Masamorelin, be able to get the benefits and a lot of our other different therapies too. So, and then listen, if it's down the line where, things aren't clicking like they should still, or there's some other issues, that's where the blood work can really come into play. But for me, I would get the blood work right off the bat. I'd know my baselines where everything's at. I'd know where everything else is at. So if I need to make any tweaks or changes in the future, I know, hey, listen, there was an issue here that I might have to go back to. But you also get a baseline for your IGF-1. And it's good to get a baseline, right? It's like anything else. Like even when you start testosterone, you obviously have to have a baseline. And you see where you were at on nothing whatsoever. And then at that point, you have that. And then you can test again within 30, 60, 90 days, whatever you want to, really, and be able to see, the improvement, right? And it's correlation of how you feel, right? And the numbers. Because placebo can work for some people. But when we have the way that you feel and we have the numbers that correlate together, we got something solid there. So that's what I'd recommend for anybody else out there. Very simple, very easy to do. Great for longevity, anti-aging, lean muscle building, weight loss. And there's so many great benefits of raising your growth hormone levels. And as we age, this declines. So at that point, the older you are, the less growth hormone you have in your body. Now, you might be at the higher level for your age group, but at that point, it's going to decline. It just is what it is. And that could play a role with genetics. It could play a role with the environment, anything you're adding to your skin or wearing. A lot of different things can affect that and be variables.
I had a quick question about something I saw online.
Sure.
As I was researching like shoulder issues, and something I saw, and I have no idea, so that's why I'm asking you, about NPP, Nandrolone. Do you know about that? Is it something I like?
Yeah. So we have Nandrolone. So at that point, if you want to use Nandrolone, it can help lubricate the area as far as being able to utilize it at a medical dose. So that's one thing. Like before, we would be like kind of stringent on who would get Nandrolone here. We've always had it.
Can we jump back for a second? Can you explain what it is and everything?
So Nandrolone is an anabolic steroid. It's a NOR19, so it doesn't work the exact same way like testosterone works, right? It works in a different function. And this can raise progesterone levels, prolactin levels, and a couple other different things. So using Nandrolone, and people use Nandrolone all the time. You can use it for muscle wasting, and people use it for joint injuries, sometimes after surgeries. There's a couple different therapeutic uses for it. But for HIV wasting, muscle wasting, that's one of the big players for it. So at that point, you can utilize this, right? Now, when you start messing with NOR19s like Nandrolone, we start getting into the area of, hey, listen, if this dose is too high or you're not on testosterone per se, then we're talking about some negative side effects. Like, and you don't want that, right? Not being able to maintain an erection and some of these different side effects, water retention, can come along with Nandrolone. And that can come along with taking testosterone. You just won't have usually erection issues. It's usually a 1-to-1 ratio of when you're going to take testosterone to Nandrolone. But even for us, we wouldn't do a 1-to-1 ratio. It'd be like a 1 to maybe a 0.25 or half, right? So if you're taking a 200 milligram dose of testosterone, we're probably going to say, hey, listen, maybe 50 milligrams, 100 milligrams at most per week for the Nandrolone.
Can you tell me how would this come about? How would this be a decision that's made from one of the providers saying, hey, this is what I think you should do? How does that come about? What kind of things do you see or would they see?
So, with the providers, like up to this point, up to this year, to be honest with you, Oxandrolone and Nandrolone, we can prescribe. It's just we were very stingent and very conservative about who got these medications. We're not there to jack people up. It's not to lose weight with Oxandrolone, like all these different things. So if they were, clinically used areas, like if there was some sort of, necessity, medical necessity that we could find, then at that point we would do it. So let me give you an example. Oxandrolone, right? This is great for muscle wasting. This was actually FDA approved for like burn victims that were laying in bed. They didn't want their muscles to go through atrophy for so long, right? So you can utilize this. Now, when do you utilize this? One, you can utilize it for somebody that just had surgery because it will help them keep on the muscle if they're having to lay in bed or not having to be as active as they were, right? So we can utilize that for that. The other thing would be a chronic injury or something you've had surgically done. So you had rods put in your back. Okay, we could possibly use one of these. If you've had a shoulder replacement, you still have chronic pain with the shoulder, we could possibly use some of these. For Nandrolone just coming about, especially now with the shoulder injuries, knee injuries, and all this other things, I'm really looking at some of the research because there's a little bit more research that's out there with this. And at that point, I went to the providers, I went to the medical director and said, listen, we need to take a really closer look at this to see, can this really help benefit our patients that may have shoulder problems, right? Because I have a shoulder problem. Like, it will benefit, it will mask it, it will lubricate the area for a little bit. It's not something that's you're going to be able to take for long, extended periods of time. And it's not something that's going to cure it. It's going to literally give you a little bit of alleviation, and that's it. And some people will use that and they'll be stupid about it. So if you have an injury, you get a cortisone shot in your shoulder, now you don't feel it because it's numb, and you go back in the gym and you just start going ham on the shoulder, you're going to create more damage. So you're not doing any good. People think they're going to go, I'm going to go build more muscle now. Like, no, you're not. Over time, you're just going to wear and tear even more down, and it's going to be destroyed. So, that just is what it is. But there's these medications out there that they can be used, these anabolic steroids, in the right capacity and really give a true benefit for a patient. So, even stanozol is out there. Like, if I showed you guys what I could get from a pharmacy these days, it made my head spin. When I first got into type medical center and then approaching pharmacies that were going to compound for me, I had my wish list. I put my wish list together and I gave it to them. And when I had on there Oxandrolone and Nandrolone, they're like, Oxandrolone, like, no way. Now, every compounding pharmacy out there compounds Oxandrolone through the roof. And I'm not talking about like medical doses, 10 milligrams, 20 milligrams. Now it's 50, 100 milligrams compounded, one-time taking. This is going to be liver toxicity through the roof. It's going to mess with your cholesterol. There's other side effects from Oxandrolone that people really don't talk about. But when you start lowering down HDL, which is your good cholesterol, that could be a cardiovascular effect, right? So we want to really look at, it's important, especially if you're going to do these medications, to really do labs and have somebody really monitor it that knows what the hell they're talking about. I see some of the coaches and stuff like that telling these guys, and the labs are horrible. And they're like, oh, don't worry, in 30 days it's going to be bounced back. 30 days comes and it doesn't bounce back. And they're like, hey, what's going on here? So, at that point, like I said, you can get oxymethylone, which is a D-ball. You could get, you can get a lot of different things. Primobolan, you can get everything. Legal, compounded, prescribed in your name. Will we do that for patients? No, guys. We're not prescribing stanozol or primobolan or D-ball for somebody unless it's a medical necessity. So if you're an anemic 43-year-old woman, that's what they made oxymethylone for. If it's something like that, then yes. But Nandrolone, I think that, I told him, like, hey, let off a little bit. If it's somebody that's not an abuser, like, they're not asking, we're going to give them a medical dose. So it's not going to be anything that's going to damage them. And they're not going to have any negative side effects. If we can benefit them or improve quality of life, that's what we're here for.
And that was going to be my next question right there, was negative side effects and damage. Because when you hear stuff about anabolic steroids, one of the first things, hopefully, people will think of is side effects. And it sounds like could you go on a little bit more about that?
Sure. So obviously, listen, there's a risk versus reward effect with anything you do, right? You get up, you walk out the door, you have a chance to die that day. Walking across the street, you get hit by a bus. If you're doing anabolic steroids like testosterone is not a bad drug. It's not going to be harmful to you. But if you abuse anything, this is liquor, anything out there, you're going to have negative side effects. If you abuse testosterone, you're going to have negative side effects. If you abuse Nandrolone, you're going to have negative side effects. You have a ton of water retention. You're probably going to have ED. At that point, there's some other negative effects of that. But Oxandrolone, I would say, listen, you take it more than 90 days, you have a chance for it crystallizing in the kidneys. Liver functions are going to be through the roof, so you better get on glutathione and start taking it every single day. You know, your thyroid is going to be, the numbers are going to go down. I mean, for sure, TSH, all that lower, and cholesterol is going to be probably messed up. Everybody that I see on Nandrolone, I can tell right away. Right away, I start looking at it. I'm like, all right, well, this guy's obviously taking something, or she's taking something. I mean, you start looking at the numbers, you start looking at the trends, and if you've seen it time over time, you can kind of recognize. You're like, all right, well, this person's taking this. I mean, I know somebody can crash their levels right away. I look at it, I'm like, all right, this person crashed their levels. So you know, it's just, listen, it's monitoring yourself. It's not saying that you can't enhance, but you better do it the right way.
So jump back just for us layman people. If this was something, a person trying to, sounds like joints, possibly therapeutic, and you do a small amount, and you're saying, I think it was 90 days. Is that right? About 12 weeks or something like that.
For Nandrolone, you could take up to like 6 months on the dose of the bottle, because they usually give you like a 5 ml or 10 ml at 200 milligrams. Like I say, you're not taking the 200 milligrams per ml. You're going to take maybe 100 milligrams or 50 milligrams, depending. So, you know, if it, well, let's say it's 100 milligrams in that bottle, it'll be 20 weeks. So you could literally take 20 weeks of the medication like that. If it's a 5 ml, it's going to be a little bit less. You know, you'll take 10 weeks.
Again, this would help with possibly joints feeling better, I guess.
Joints.
Some extra muscle possibly at this stage. Joints, in a safe way. And so I'm just trying to figure out why the internet is such a buzz about it right now. And so I think that's one of the main things we talked about. It's like, I thought it'd be a good idea for people to listen to you explain this, the pros and the cons.
Yeah.
Like anything. And I agree with you. Do it safe, do it smart. Yeah. So if that is a route that you guys are thinking, again, a short-term use for that. And then make sure, again, the provider kind of sets you up and says, this might be a smart thing or not. Yeah.
I mean, the provider's always going to do the right thing. They're going to do the most conservative thing for you, just to make sure, listen, at any means, you're going to be healthy doing it. You know, and like I said, with Nandrolone, the other thing is, I would tell people out there, if you're an athlete and stuff like that, and you're getting tested, after your last injection, you still got 12 weeks in your system. Nandrolone stays in your system for a long time. So at that point, just make sure you know what you're doing if you are doing that. But yeah, I mean, listen, your strength will go up. You lubricate the joint areas. Just don't be stupid with it and say, oh, well, my shoulder's feeling great now, and I'm going to go ham on it. Probably not a good idea. Probably not a good idea.
That's a very smart point for anybody out there that, again, that hasn't joined up at Titan Medical, is when you do start getting stronger and stuff. It may feel good and everything, but remember, the muscle's getting stronger.
Right.
The muscle's getting stronger. The ligaments are not so much used to that. So be smart about that kind of stuff.
Right.
Somebody in the chat said, my dog needs some of that. She's walking around lazy, and said, it made me think, is there peptide therapy used for animals?
So that was the next venture that I wanted to get into, honestly. Preventive and anti-aging care, veterinarian style. The reason I wanted to do this was, one, it's there. Regenerative medicine for pets is there. 100% works just like people. We do PRP treatments on them. I mean, there's a place right down the street from me that does it. I mean, they've got it really advanced. I was like, oh man, they're onto something. I was like, this is what I want to do. Even with the blood work, when I took my golden doodle in, you know, just to get checked out, like, and she had to stay there. She got 2 IVs. She got seen by 2 doctors. I think they gave her 1 medication. It's $4,000. I looked at the blood test. I'm like, a CMP, a comprehensive metabolic panel, that we would charge $30 for. They charged me $300 for. So I'm like, this is crazy. I'm like, man, I could really save people money, make money, and then really get into the pet side, because there's no laws on peptides or anything for pets at all. I mean, I know guys that used to inject their dogs with testosterone. So at that point, like, I wouldn't do that. But peptides for joints, absolutely. Like, even a Titan Complete. I know a person that told me, listen, I'm giving my dog Titan Complete. I'm like, I don't want to know. That's great. But you could do that, right? Like B12 shot. I mean, there's anything you do for people, you can pretty much do for animals. And this goes across the board. This can go to horses. This can go to cats. I mean, any animal pretty much. So that's kind of what I was going to look at doing next. I've actually talked to a couple of veterinarians about it. Listen, you want to get into doing something else? They're doing like mobile, you know, being a mobile vet. I'm like, this is great, but like, I'm like, you could be doing something a lot better, and pioneering it. It'd be really, really good. So I don't know, something to think about.
I understand. I'm looking at a research that people used to give, or vets, I'm sorry, doctors, vets, used to give Anavar to dogs as they aged to keep the muscle on and keep them healthy. So that's interesting. I don't know why they stopped, but it just says that they did that. So that's an interesting thing, that even your pets, as they age, have such a short life.
The only thing about it is this is where you're like, all right, skirt, right? Is when you start taking oxandrolone, it's a DHT derivative, right? Dihydrotestosterone derivative. So once you take it, now you're going to shut down your natural testosterone. So you shut it down. So it's not the best benefit, right? So that's where, honestly, if you're worried about atrophy, that's where the growth hormone peptides come into play, because they help keep on that lean muscle. Or even growth hormone. I'd say growth hormone too. I'm not going to throw it out. You're taking growth hormone, peptide, it's gonna help with the muscle wasting or atrophy that might be going down, and you're not going to shut down natural production of testosterone. That's the only thing. If you're on testosterone, like me, I've been on for 13 years, it really doesn't matter, right? The only other thing I would say, the caveat is this: if you take oxandrolone and you have predisposed male pattern baldness in your history, this could up the effect of you getting thinner or losing hair too as well.
A lot of great information today. Holy moly. I got a freak of a man hanging out with me. Obviously it's Jeff. And then also Billy Gunn is here, has a question for you. Oh, I did.
What's up, Billy Gunn?
What's up, buddy? How are you
doing, man?
Just came to hang out for a couple of days and get my head back right for my training.
I love it.
So I guess my question would be, is there's two kinds of Nandrolone, right? There's the regular DECA that most everybody knows, and then the new thing, what they're talking about, the NPP, is more faster acting. So what would you say? I guess my question would be, is it, if you wanted to take something like that, would it be better to take the MPP only because it's the half-life is so much shorter?
The half-life is there. I've only taken Nandrolone decanate. The MPP will work a lot faster. Obviously, it's in and out. Right. So, I mean, you get shorter. I would guess shorter term benefits real quick.
Yeah.
Right. So you probably get the masking or the lubrication of the joint areas. So I mean, it'd be worth it for sure.
Okay.
I mean, at that point, listen, if you're in the perfect world, right? What I would be doing is this: if I had MPP and I had Nandrolone decanate, then what I would do is whatever the dose is. So if I was only going to take 100 milligrams a week, I would take my testosterone shot on Monday and I'd do 50 milligrams of the MPP. And then on Thursday, I would take my testosterone and I would take 50 milligrams of the Nandrolone decanate. Now I have short acting, long acting. Even my testosterone, it's a tri-blend. So it's got all three esters, right? So I'm hitting those notes and I'm never missing a beat.
Right.
And that would be, I would do it optimally. If I had to pick one, it really is up to the person usually. But MPP, they're both really good. But if you want the short-term effects, you want out of the system quicker, MPP is going to be the one to go with.
Okay. Yeah, that makes sense to do them both. Okay.
Yeah, if you split them,
the same thing about
you get all the benefits.
Yeah,
right? And you don't got to choose.
Get it all in one thing. What else questions do I have?
What about getting BPC and TB500 mixed in a vial?
So you can't get it from a compounding pharmacy mixed in the same vial. They don't create it.
Right.
Research chemical sites create it. That's why you see those blends out there, but it's not from a real life pharmacy.
So that seems to be, for me, when I read that seems to be the new hot thing. Like, I know me and Mike had this conversation. He had talked to me about peptides, but it just kind of went in one ear and out the other, because I don't know. I just wasn't interested in listening to it, I guess.
Understandable.
Or that day, I just didn't want to hear him. like here, everything, like it seems like everything on my feed is the 157 and the 500.
Yeah.
Like I feel like everybody's kind of jumping on board to the benefits that it has for repairing, repairing tissue, or I don't know exactly. You would know better than I would about what it repairs and how it repairs, like rebuilding your muscles, like putting your muscles more healthy, and then going to like an IGF-1, what you were talking about, to kind of kick them back in gear. Is that like the thing now?
Yeah, I mean, honestly, you could do all three together. I would do BBC and TB500. Now, it could be for preventative. It could be to strengthen the ligaments and joints and tendons, and also help for recovery on muscle building. That's where people overlook it. You know, we're talking about recovery. So in every step of recovery, those will definitely help. So at that point, I mean, those are a winner. You know, they're a winner to throw in the regimen one way or the other. Whether you have a acute or chronic injury or not, you're going to get benefits from it.
Right.
So that would be one aspect. And then obviously the GHRH peptides or IGF-1 straight, you know, that's going to be a winner to always throw in there for sure. 1,000,000%.
Because I feel now that everybody kind of, I guess the concept is we kind of tear our muscles apart to make them bigger, right?
Sure.
So now it's kind of like, I guess it would be kind of like, hey, how do I repair them faster so I can get more bigger?
Yeah.
You know?
No, absolutely.
Like how do I fix the tore up muscles that I'm trying to get bigger? How do I fix them faster to make them even bigger?
No, absolutely.
Right? Is that kind of,
you want your body working as fast as possible as far as that goes. You know, break down those fibers and start building up those little fibers and you know, for sure. That's definitely where it's at. You know, and listen, if you're on testosterone replacement therapy and you're on these peptides, you're going to recover faster than a regular guy. Let's say you're 6 years old, you're on testosterone, your levels are like 264. You're not going to recover as fast as somebody that's on HRT. And then if you're introducing some of these peptides, it's going to be a game changer of one, of how you feel, two, the way you can recover, and three, the way you look.
So I'm just going to keep asking questions.
Please.
So what would be your three top, because I know there's a bunch of different IGF-1s, right? There's a straight IGF-1, there's an IGF-1 dose or deck or whatever that
there's
is.
There's an LR3, and there's the regular one with
DAC. In your mind, say, what would be your three top IGF peptides for like muscle building, I guess, or sports and like whatever they're calling it.
Sure. So one would be IGF-1 LR3, two would be hexarelin, three would be MK677, and four would be testosterone. I had to put four in there. Okay. So IGF-1 LR3 is a game changer, right? IGF-1 straight, boom. There's no race, right? It's right from the starting line to the finish line, and you're getting the absolute best right there, right off the bat. Two, like I said, with I would say hexarelin. Hexarelin's a growth hormone releasing hormone peptide. It's been great for muscle building, especially for a lot of patients. Like, we've been throwing them on it. They've been getting great results. I threw a couple of girls on it. They were kind of mad at me. They said they're getting too bulky. So I'm like, I'm like, all right, cool. Well, girls aren't going to get this then unless they want to get bulky, and we'll start giving this to guys.
Right.
And that's it. So MK would be the other one. If you need to eat, you need to stimulate growth hormone, that's going to be another one, right? So it's got two tools in one. One, it's going to give you the IGF-1 effect of stimulation there. So recovery, anti-aging, all the great benefits of that, strength. And then you're going to have the eating portion. So there's people out there that can't get the calories in. They can train their ass off. They're trying to eat and they're just shoving their face and like, man, I just can't eat no more. Well, you introduce this, you're going to be able to eat. And then you got the calories, and then you can start building some more mass if you want to do that too as well. Right. Okay. Testosterone, I just had to throw that one in there because it's FDA approved. It's a growth releasing hormone peptide, so it raises IGF-1 levels, and it's the only one that targets visceral belly fat, so stomach fat. So the visceral belly fat, the fat that's around your organs, that's real bad, it targets that and starts eating at it. So, you know, that's the only one that's FDA approved to even do something like that. So at that point, I gotta throw it in there because it's a monster too as well.
Yeah.
Did you rank those in order of most effective to you, or was that just a list?
Oof, that was just a list. So what would be your
ranking.
What would be my ranking out of those 4?
Yeah.
Oof.
Sorry.
IGF-1 LR3, tesamorelin, MK, and hexarelin.
Oh.
So let me ask you this. So you said, so yeah, from me just listening, the IGF-1 and all that is a growth hormone releasing peptide.
So the GHRHs are IGF-1 LR3 is IGF-1. That's it.
Okay.
It's a long lasting IGF-1, so it has a longer half-life than the regular IGF-1 does.
So
Regular IGF-1 is within your body, in and out. I mean, quick, real quick. So you want the LR3 for sure.
Yeah. So would you say, so I'm trying to figure out how to put this. So growth hormone, plain out shooting growth hormone is to mass majority of people is expensive to do. Right.
Seriously expensive. Yeah.
So because I've heard people say that it's, $600, $800 something dollars a kit. And that's what, 10 something or another, whatever, how that comes or however. It comes.
I would, if I was going to do growth hormone, I'm like, all right, so like, let's say you wanted 8 vials of 5.8 milligrams of Omnitrope from the pharmacy.
Mm-hmm.
My cost can be around $4,700. My cost. Right. But that's a lot. I mean, that you're talking about like 19 IUs, 17 and 19 IUs per vial, depending on how you dilute it.
Right.
So I mean that's a lot for somebody, right? If you're going to take growth hormone, something like that, you're going to want and not from a kit from China or Red Tops. I'm talking about from the pharmacy, like from like Eli Lilly or somebody big like that, Pfizer, some reputable name that's producing this. At that point, you're taking 2 IUs a day. You're going to stimulate your growth hormone levels to a great optimal natural range, and you're not going to really have to do anything from that point.
So the 2 IUs would be optimal for maintaining your original growth.
Yeah,
because I know some guys that shoot like 6 and 8 IUs a day.
Of course.
So now we're
see
getting
their
into the
IGF-1
bodybuilding
levels.
range stuff, right?
Absolutely.
Okay.
So I mean, even for those guys, like I'm like, hey, listen, I want to see it on paper, right? Because I got some guys that come to me and then they're doing their own thing. And I'm like, you're doing your own thing? I was like, let's see it. I want to see it. I don't want to hear about it. I want to see it on paper, black and white. So we'll run the blood and then it'll come back too good. I'm like, how much you shooting, bro? Like, yes, like 6 IUs a day. I'm like, dude, there's no way. If you took 4 IUs a day of real growth hormone, you're going to be in the 400s of IGF easy. Usually like a normal person is like my age, I'm 44, is like a normal mid in the reference range right in the middle is probably like 150, 160. If you're in the 200s, you're doing good. So, and as you age, that reference range comes down too as well.
Right.
So if you're 60, then at that point, like your reference range might be 120 to 230, right? And then if you're at 230, you're like, oh, this is great. But if you're at 300, now your body is really working. Like it's producing and it's working optimally. And all those different functions from growth hormone are working too, So that the only thing that, I have to say is a caveat to people out there, because they always ask me, and I have to be transparent about it. Like, listen, when you take growth hormone or any peptide, growth releasing hormone peptide, what it does is it grows cells. Okay. And as you age, you have less cells in your body, but you have cells. So it'll grow all the cells. It doesn't pick like a good cell or bad cell. So if you have cancer cells, it will grow it and fast track that. That's the only thing that I have to, and I always throw it out there. Does it happen a lot? No. But if you have history of cancer or you've already had cancer, probably not a good treatment for you to take. Right. But for the normal person, listen, I think that, growth hormone peptides are the way to go. They're a lot more inexpensive than regular growth hormone is, and you can get a great result. If you abuse regular growth hormone, go ahead.
Sorry. So you could get, I feel you could get just as good benefit from a growth releasing hormone, right? If we're only in that certain range, if we're trying to get maybe that range or even a little bit more, you could use a peptide that will get you to that point instead of doing busting $5,000
for sure. $1,000,000%
to make your body run regular on, like, because if somebody said, "Hey, it's going to take $5,000 for you to run regular," I go, "Well, I guess I'll just run on."
Yeah, I'll hobble.
I'm good there.
I mean, it is what it is. I mean, that's the saying. Like, it's a fraction of the cost. I mean, it's something that's doable for everybody out there, right, and they can get the benefits from it. So why not? I mean, even if you take regular growth hormone and you take too much, or you become a type 2 diabetic. If you eat wrong and you're taking growth hormone the wrong way, there's negative things that could happen to you. So, right, I always tell people, I'm like, listen, just make sure you know what you're doing. You're monitored. You're getting it from a professional. You know what's going on, and then you'll be okay. If you try to play Frankenstein or play it your own way, you never know what's going to happen.
Right. Okay. Yeah. That's okay. Yeah, because I just kind of been looking more into, because that just seems like, I told Mike, it just seems to be the thing now. Like it is because I feel, and it's just me and my whatever I think, is like peptides have always been for bodybuilders or anybody trying to gain big muscle, has always been the AAA ball, right? You want to go straight to the pros, you go straight to the gas, right? You go where everybody wants to go to make all the money. But it seems like they're so good now. It just seems like they've kind of made, and it's probably been longer that they've been really good. It's just, it's the same thing with, overdoing gear or whatever. It just has such a bad stigma. It's just like doing hormone replacement and doing TRT. There's such a bad stigma attached to that I feel a lot of people don't understand. It's just to make you run better, or make you, expand your ability to live. And they hear that testosterone, oh, that's a steroid, and you're, I know it's getting a little bit better, but I think that the peptide thing is coming around more to where you don't get the bad side effects as you take, taking $100,000 worth of stuff a year in your body. You get big, but your insides go to crap.
And then you ain't doing shit with it. That's what I'm saying. Insides are everything. I mean, listen, if I had to pick, do I look horrible on the outside or look horrible on the inside? I guess I would take horrible on the outside. Because if everything's working good on the inside, at least I know I'm going to live. You know what I'm saying? Right. So, I've seen people go down like that. It's crazy how that works. And, you should have seen 13 years ago, Billy, when I was talking about HRT to people. They really thought I was crazy. Or for sure.
I can imagine. Well, being in your line of work, it's kind of, trying to get people to understand that it's not what everybody thinks it is. You know what I mean? It is a huge benefit.
Absolutely.
Absolutely. And it just makes you feel good. It makes you run efficient. It makes you do better at work. Just makes you better all around in life. And if they would just kind of push that to the side, we'd be all good.
Yeah. I mean, listen, the studies are out there. The clinical data is out there. Testosterone is not going to hurt you like that. It's not going to cause you to have a heart attack. It's not going to be aggressive. Like, we know testosterone. You need testosterone. We were born with testosterone, women and men, just at certain levels. And all we're trying to do is just replace that to an optimal level, like back when you were like 21. Hey, didn't you feel good at 21 years old? Do you feel good now? Probably not. So let's do something about that and upgrade, your quality of life. That's literally what we're doing. You're turning back the clock 100%. On the inside to upgrade your quality of life. And then you reap all the benefits, more energy, right? Your brain processes faster. You're better in the bedroom because you get an erection now. You feel good about yourself. I mean, that's what you should feel like, like the whole thing the last couple of years of toxic masculinity. Like, we need masculinity. We need good men, like straight up. We need good women. So at that point, like, there's going to be a little bit of masculinity that goes along with that. And testosterone is a prime player for that. And anybody that says no to me, go get your testosterone checked, because I guarantee if you fix that problem, you won't be saying no. Guaranteed. I guarantee it. I mean, I've had people tell me, I'm never going to take testosterone. Literally, probably about 5 years later, they call me up. All right, I think I'm ready. And they take it like, man, I should have started this 5 years ago.
Right. That's the thing is it's just trying to get them on board, to get rid of that, because it's our brains that stop us from feeling good, right? It's that thing. But thanks. That was good. So let me ask you one more thing, being
sure.
So let's switch gears a little bit back to the TRT. So give me your thoughts on the pellet stuff.
Okay. All right. Pellets are great in theory, right? You go in, you insert them. They're in there for 90 days. You're on about your way. You don't have to worry about injections, creams, pills, nothing. Awesome by theory. Problem with pellets. Pellets are inconsistent. So everybody metabolizes pellets differently, right? So Billy might metabolize something a lot different than what I metabolize. But what they do in the beginning is they insert the max dosage in you of what you're going to need for those 3 months. Now your body starts metabolizing these things. What happens? Everything starts spiking. Testosterone goes up. You start feeling energetic. You're like, all right, great, this is fine. But then estrogen might be creeping up and all these other hormones might be creeping up. Right. You don't even know. And then you start going, you're like, all right, well, I felt great. And maybe like month 2, now I'm not feeling so good. Right? I'm starting to feel a little unenergetic. Erection start is good. Maybe I'm a little water retention. I don't know. So I go back in 90 days and back on your way. The problem is you go up and then you start coming down.
Right.
So it's no consistency of how you feel. Girls, it's even worse.
Yeah.
Guys, listen, if you spike their testosterone, let's say it's over range and it gets to 1,500, 2,000, it's not going to hurt the guy, right? It's not going to do anything to us, but maybe deepen your voice a little bit more. It's going to make you a little bit more masculine, a little bit better, in my opinion. But for a girl, when it spikes like that and they stay like that for long periods of time, viralization happens. Enlarged clitoris, right? Their clit gets bigger. Right? They have little small baby penis is what they call it. They get a deepened voice. Comes on quick. It's not something they're going to stop. And then facial hair or hair in body parts where they've never had it. And usually you don't want more masculine traits either. If you stay on it too long, it's like a transition, guys. It'd be just like a transition. If I was going to transition a female into a male, I would give them a high dose of testosterone, give them an estrogen blocker, and they would start looking more masculine. They start having more masculine traits, even in their jawbone and their jaw lining, excuse me. So that's my thing about pellets. I've had so many horror stories. I don't know how many people we fixed with pellets. It's always a problem. So I've never felt anything bad about it. So here's the other thing. So when you go on pellets, let's say you're a guy, you go on pellets. Now you're like a week or 2 into it, like, I'm not feeling so good. You call the guy up, they doc, hey, I'm not feeling so good. They do the right thing. They're like, all right, well, let's send you for some blood work. Let's see where everything's at. They send you for the blood work. Your testosterone's through the roof, great. Now they didn't put enough anti-E or estrogen blocker in you. Now your estrogen's through the roof. Now what they're going to have to do is now you're going to have to take some pills to lower it down. So you're taking pills anyway, right? You're adding to the regimen. So it's just stupid to me. Like if you take injectable testosterone or even take the oral that's sublingual, you're taking the injectable and you split your dose. You're taking it 2 times a week. You're up and you stay up. There is no coming down. There is no. If you're taking the sublingual one, you're taking that every day. So you're up and you're staying up. So that's the more consistent route. If you need to adjust a dose, you can adjust it too as well. So, I mean, it's easier for a patient. They can stop the ride whenever they want. They can fix the ride if it's off track whenever they want. And they're not stuck on the ride when you're on a pellet, because you're stuck on the ride until they're gone and out. You're still on the ride. So at that point, you're having the effects.
Well, because I know the only reason I asked, because I know a few guys that take that, and I was kind of on the same wavelength, kind of almost being like it's not a no-brainer. Like you're just sticking it in there and hoping your body releases it the way it's supposed to. But I don't see how that's, like you said, we all metabolize or we all use it differently.
We all metabolize
it just feels like, you'll get that. And then all of a sudden it goes away and you're like, hey, what's going on? But like, to your point though, you can't fix it. I can't fix it.
No, like literally, like you're either adding the dose. If it's a girl and that testosterone jump like that, like last girl I seen on pellets was 2 weeks ago. She came in here with blood work. She's at 400 total. 400. I'm like, listen, 0 to 44 is a natural range. 100 is doing great as a female. 400, dude, I'm like, that's a problem. She's like, yeah, I don't feel so good now either. I'm like, all right, well, we're going to wait till this wears off a little bit, and then we're going to transfer care to us, and we'll take care of it from here.
Yeah.
Awesome. You know, I mean, because once you have your dose, like say injectable, you have your regimen, once you're dialed in, as long as you're consistent with taking it like that, your numbers are going to be great. You're going to feel consistent across the board every single day. So, like I said, that's definitely the best route. I would never do pellets. I would never let our patients do pellets.
Yeah.
And just that's why. And over the years, it's been bad things.
Okay. All right. Well, I'll let you get back to the boring questions with Mike.
Yeah.
I will say though, he killed that. There's some really great points he brought up that I want to run back over. I'm interested on a couple things real quick. Is your top 3, 4 of the IGF? What was the reason for your 1, 2, and 3? Not just the top, but why 1, 2, 3?
Sure.
And then I thought it was great. He said something, and this is going to be overlooked by every single person out there. And Jeffrey, just make it, and then you guys out there too, you make a clip of this, because he made a point there that I think most people will miss.
Oh yeah.
On the IGF, where's that number that, hey, you're recovering? No. If I can go to 400, I got to go to 400. But hold on. I get it. It seems like that's the goal. But if 250 is great and you're going to recover off of 250 and you can save money, less side effects, and all these things, you know what I'm saying? It's
absolutely.
like, I think society and especially bodybuilding world is like, if I can get 400, that means more to me. It's like, wait a minute, stop. Right now, stop. The point is you're going to get, let's say hypothetically, even if you do get 1% more at 400 compared to 250, what are you giving up on that aspect? And I think it goes also not just with the IGF, but it's also the T. Like if you got your numbers at 1,000 to 15, great. You're going to gain some muscle there.
Right.
If you're disciplined on every other aspect, you don't need it at 2,000, 3,000. I need everything. It's like you're so I just think society is going to miss that. And Billy said that. And it's like, that was a great analogy of you're recovering, you're building muscle.
Sure.
Stay there, stay in this lane. And you're going to be able to do this for a long period of time at a level that nobody can be at.
See, there's a difference here too, right? We're talking about getting to optimal levels and not super physiological levels. And the other thing about it would be this. Yes, going to 400 might give you a little bit more recovery, but now we start putting more risk. So when we talk about growth hormone or anything like that, when we start raising IGF-1 levels and we start increasing the cells, you also got to start talking about enlarging organs, aka your heart, your liver. I mean, these things can be enlarged by taking massive amounts of growth hormone too. So there's always a risk factor with going above. And it's not about being excessive. It's about being optimal. So taking quality over quantity. Even the guys that say I have to take 3 grams a week. Dude, you don't have to take 3 grams a week to be a mass monster. You don't. You don't. I mean, it's proven, right? And now, are you going to get like that on 500? Probably not. But at that point, if you're optimal, and let's say you're at 1,500 above, there's only so much your receptors are going to take in too, as well, right? So we got to start looking at some of these different things and being smarter. I think if people were more strategic and more smarter about what they were doing, I think they'd get way better results and have it more dialed in instead of, hey, listen, we're going to go with these protocols. I'm seeing these protocols just they're getting even worse. I don't see protocols getting better or safer. I see protocols from coaches getting worse and unsafer. So at that point, I'm like, why? Why do we have to get unsafe to do this? Why can't we? It's one thing if we're encroaching the line or the edge, But it's another thing we're thinking, oh, well, I'm just going to skydive off this edge. No problem. I'm going to be safe going over. So, I think that's something we need to look at. Like, can we get more benefits from doing less or soon doing some different things that maybe have just been, some of these different things that people have been taking, it's just been ingrained in there for years. And it's like a copycat effect. They're just adding into the protocol of what somebody wrote a protocol for them, and they're adding in maybe some different touches that they did. So, and I don't know. I mean, I guess,
if you go, anybody here, go watch Lee Priest talk about how he trains somebody or his protocol. And I love this because if you listen to some people like The Hobbit, he talks to the most extreme levels where he never created anything pleasing. Where you talk about Lee Priest, who created one of the greatest physiques, one of the greatest. And I think Ronnie Coleman still talks about losing to Lee Priest on stage was one of his biggest. And I love that fact because of the fact that Lee Priest is the guy that goes, you guys are taking way too much. And I think that goes back to society. I got to take so much to do this. It's like, good job, Billy, for that. And he's never good on camera. So this is great.
He killed it.
Today. So Johnny, thanks for hanging today, brother.
Wait a minute. I appreciate it.
Don't run. Why the choice of peptides at night in the order you put them in, please?
Sure. So the reason why I listed the peptides and what I listed them at, this is the reason why. IGF-1R3 is one of the best. That's why you need blood work to do it. It's really, really good, right? It's not like a peptide where it's gonna, it's IGF-1. So it's straight to the point. That's why I like it. You can only do it for so long before you have to get off of it. So I would put it as number one because that would be the first thing I would go to.
So all right, best numbers possibly, at least for you, for a period of time.
Best result.
Okay.
Quick, right? Like I'll see a quick result with it. Testosterone would be my second one because obviously, listen, it's got the approval. It's got the FDA approval. It's got the clinical studies for that, the trials. I love that. And the other thing is that taking off visceral belly fat along with raising growth hormone levels, I'm with that. Like that's what I'm
Makes
with.
sense.
With MK after that, I would say, listen, if I need to mass gain, I need to eat calories. This is why I put it as 3. It works very well. It's very efficient. It's an oral capsule. This is something you can take and get the calories in.
You got it there, my man.
Right. Start training, gain that strength, gain that lean mass. Okay. 4 was hexarelin. Hexarelin is definitely there. And that could have been a 3 too. That was in between with MK and that. It just depends who you are.
Yeah.
And at that point with hexarelin, you're talking about another GHRH and you're talking about something that's great with building muscle, like great. So that would be my 4. And that's the reason why. Now there could be, listen, you could start playing around with this too.
But also those 4, you change them up during the year.
You change them up.
So you're getting that. And so for the person out there that's going, I like this one more than this one. Well,
right.
You're gonna switch those up anyways.
Yeah.
So
and then you'll get like 2 or 3 that you really like, and you keep them in that rotation.
Yeah.
And you just keep switching. Like, oh, man, this is great. Like your body keeps switching. And it's just shocked. The way its mechanisms, the way it's working. It's awesome. Now with IGF-1, listen, you take IGF-1 in the morning per se, right? And at that point, like if you want to use MK because you still need calories in, you can utilize it for that. So you could combine some of these different things. Or if you took IGF-1 in the morning, you could take testosterone at night.
Okay, so you could do the IGF in the morning and then take the either testosterone or the MK at night.
Or the MK at night.
Right.
I mean, you could do, listen, if you just like hexarelin, like I don't like IGF-1R3. I didn't get a good effect from it. Okay.
Let me get this name again right. IGF-1 /
LR3.
LR3. So just write that down, everybody. IGF / LR3. And this is something you could possibly take in the morning to help you. And then also still have the testosterone or the MK at night. Yep. So now you're optimizing again. Check the numbers. Make sure the blood work shows that not only are you doing this twice, but it's also helping your IGF. Because again, at the end of the day, the numbers can't lie. They're going to tell you, hey, you went from 150 to 200 or something like that. I heard that. They're ready for their walk.
Oh, it echoes back here.
I love it. Johnny, thanks for hanging today, brother.
For sure. Always my pleasure, man. I appreciate you guys as always. Thank you guys so much.
And a big props to Billy Gunn jumping on here for
yeah, big shout to Billy. Thank you, Billy. I appreciate it. Good questions today.
The legend, the Hall of Fame, WWE. He just finished up WrestleMania and came out here after that event to hang with me for a week, and we're going to put 15 pounds on him this week alone.
Yeah, I love it.
Go get it, guys. Johnny.
Later, Mike.
I'll check in later.
All right, bro. I'll talk to you soon.
Thanks, man. Hey, guys, I will make sure that this is up. You feel free to clip this and go back to it later. I think it was great information today. Great questions from, again, from Ask Man. And that is a good one for the growth hormone effect at night, the IGF in the morning, and the testosterone or the MK at night to really maximize recovery for your body. That's my clip of the day right there. I think that's going to be your golden ticket. Make sure your T levels are healthy. You optimize it, and please don't abuse anything in life.